We spend a lot of time preparing teaching strategies to help our students learn. We want them to stay engaged. We want them to enjoy the learning journey as we help them make safe patient care decisions. That's our role as a nurse educator. Welcome back, everybody, to Dr. Sellars Educate. We're happy that you're back. And our mission here at Dr. Sellars Educate is simple. We are supporting nurse educator colleagues from around the country to help them achieve excellence. And this is what we know: anything worth having takes time, takes commitment, and it takes quite a bit of focus, especially when it comes to getting ready for the CNE exam. There's something very exciting that has happened, and I know for those of you that are watching the news or those colleagues that are very heavily focused on science, you know exactly what that is. And that is the Space Shuttle launch. Okay, so we're going to talk about that. So, welcome back, colleagues. We are exploring what are the evidence-based practices that are going to help all of us as nurse educators stay focused on evidence-based practices and integrate those into our everyday learning experiences that we are developing in partnership with our students. Learning is a partnership. There's an exchange, there's a transformation that happens. We design teaching strategies that are evidence-based. We thread them across our curriculum, and we take our students along. We focus on those learning outcomes that we want to achieve every single time there's an interaction that we have with our learners. And we develop assessments, evaluations to validate that learning has actually happened. We're exploring in this snapshot all about preparation. How do we prepare our students for excellence? And it would only be appropriate for me to talk about the exciting event that has happened. So Artemis 2 mission was successful. Round of applause for the amazing astronauts that I'm sure worked many, many years to prepare for this really important time. This is a picture of the crew members of Artemis 2, and it's a historical moment for many reasons, but first and foremost, did you know that this type of mission has not happened since 1972, which happens to be the year that I was born? And I'm excited to be a part of witnessing this amazing mission that this crew is going to be able to achieve. And it didn't go without a lot of work and proper preparation. Just like your journey as a nurse educator, our goal is to achieve excellence in the classroom, to make sure our students are learning the key concepts that are needed in order for them to make safe patient care decisions. So we know proper preparation is key. Let's dig into exactly what that preparation and ultimately the transformation that had to happen in order for the shuttle to launch successfully. All right, so this is the liftoff weather criteria. I thought this was fascinating when I heard about it. All right, so there's 4 main categories that have to be explored and literally have to be checked in order for the space shuttle to launch. First is the wind. The launch is a no-go if peak winds exceed 29 to 39 knots. I want you to think about that. That's a criteria. The wind. Can we predict what the wind is going to be? No. However, I'm sure there were many meteorologists that was monitoring that throughout the course of the day, even days before, right? Because this is a known criteria that has to be met in order for the space shuttle to successfully launch. That's what we all wanted as we patiently waited after liftoff. We wanted there to be a successful launch. All right, so what else is it that the forecasters, the meteorologists, the space shuttle team, what else is it that they look at? Lightning and electric fields. So no launch for 30 minutes if lightning is within 10 nms. Wow, that's not a long distance, right? So you think about the distance that they have to monitor to ensure there's no lightning strike. What else? Temperature and precipitation. Surely can't control that. But I'm sure there's quite a bit of work that goes into looking at what the temperature ranges usually are during this time of year. All right, and then solar activity is the last criteria. Launches are restricted during severe solar events to protect electronics and communication. All of these 4 elements are related to criteria to keep the astronauts safe and to keep the overall launch itself safe, because we know there's a lot of risk that are associated every single time there's a space shuttle launch. So that's what we're talking about, this transformation that this crew had to go through. And the crew is more than just the 4 astronauts. We know there's quite a bit of work that the entire team has to go through in order for there to be a successful launch. So I'm really thrilled to witness such an amazing activity that has happened with Artemis 2 successfully launching. CNE in 60 days. If you haven't heard, it only takes 60 days for you to achieve that passing score on the CNE exam. Now, this is what we know. There is a blueprint, okay? So if you haven't tuned in yet, we do have a Blueprint for Success workshop that's offered every single quarter, okay? So make sure you take advantage of that. We will send updates. Make sure you subscribe to our list in order to receive those updates so you know right away as soon as we are launching that CNE Blueprint for Success workshop, okay? 60 days is going to look like a compressed period of time, focusing on the exact resources that you need. So let's talk about those resources. Okay, so first and foremost is Billings and Halstead. This is the 6th edition. The reason why we're still using this edition, in case you haven't heard, is this is the one that the exam writers used when they initially developed the blueprint and wrote the exam questions back in 2023, okay? The next resource that's optional is Dr. Caputi's CNE Review Book. Now, this is a good, what we like to say, Cliff Notes version, but it doesn't go deep enough. In order to go deep in review of content, you have to have Billings and Halstead, okay? But this is a good overview to get started. It's optional, and I will go ahead and share one of the resources we love about Caputi's Review Book are those practice test questions at the end of every chapter, okay? You can use those to help clarify muddy points, or maybe it's going to validate some muddy points for you. And then the last resource that so many colleagues really like, so we wanted to share it, is our 7-week study plan. We have a 97 to 100% success when following the 7-week study plan. Okay, so that equates to CNE in 60 days, and this is part of our workbook. This was developed because so many colleagues said they needed one more resource to help them on their journey, and that's why we developed the workbook after about a year and a half. The beautiful thing about our CNE in 60 days program, you don't have anything else to buy. It includes all of the resources we just talked about, and it's a weekly session for 6 weeks for an hour and a half, and then at the end you have a master class. So we engage in what's called micro learning by dripping content every single week for 6 weeks, and then you engage in a master class where we're closing the loops, we're tying up any gaps, we're closing any gaps, tying up any loose ends associated with the content that we cover throughout the blueprint. All right, so now let's get into our content. We decided to take a little bit of a different angle in this snapshot, and we are actually reading the current edition of the Nursing Education Perspectives. So hopefully some of you all have either access, let me find my copy, either access to the digital copy or the actual physical copy. Okay, so this is the edition that we're referencing for our conversation today. Another resource that you want to use is going to be Billings and Halstead. We are going to use page 298, okay, which is, it discusses problem-based learning. Okay, so again, if you have the access to Nursing Education Perspectives, it's going to be the March-April 2026 edition, and we're focusing on the research that was just released. First of all, this actual edition has a lot of great resources. One of my former colleagues also published an article about caring, and it's a really good article. So this is on page 113, and it is by Wilgenbush and Noor. Okay, so you can see the authors right here on the screen. What we really liked about this article is that it explored some of the concepts that we're talking about as it relates to the development of clinical judgment. We've been on this journey of exploring competencies 1 and 2 in our snapshots, as well as in our monthly boot camps. And here's why. 50% of the exam questions for the CNE is aligned with competency 1 and competency 2. Okay, 50% of the scored questions. So there are 150 questions on the exam, and we know that 130 of those are scored. 47 questions align with competency 1, and then you have 18 questions that align with competency 2. Okay, so that's how we get to the equation of 65 questions, half of the scored 130 questions are aligned with competency 1 and 2. This is why it's so important to make sure you're doing that individualized self-assessment using the NLN blueprint that is included in the actual candidate handbook on the nln.org website. Okay, so make sure you go there if you haven't already, because that's going to be where you start to make sure you have clarity around what to expect on the CNE exams. Okay, so all 4 of the exams have their own candidate handbook that you're going to go print out so you have clarity and confidence about what content you will be tested on for your specific exam. And when we talk about case-based learning, it's also called problem-based learning. Okay, we talked earlier about page 298 in Billings and Halstead 6th edition. This is where you're going to see a description of problem-based learning. So what is it? It actually uses clinical problems and professional issues as the focus for integrating the content necessary for clinical practice. This actual teaching strategy also aligns with Patricia Benner's novice to expert model, where she talks about the importance of bringing the clinical experiences into the didactic setting. Okay, we don't want to wait until students get into the clinical skills lab or simulation setting to actually introduce students to actual clinical experiences. Okay, problem-based learning, case-based learning is an excellent way to introduce students to the decision-making requirements when it comes to clinical care. All right, so let's talk about a couple of elements related to this research. Again, when you look at nursing education perspectives, there can be questions on the CNE exam. All right, so I'm going to come back on large screen because I didn't talk about this earlier. All right, so you may wonder, okay, why are we talking about nursing education perspectives? We haven't talked about that before, and you're right, we haven't. What we have found, many of us content experts here at Dr. So's Educate, is that this actual journal is published by NLN. Well, it's published by Walters Clore, but it is affiliated with NLN. And because so much of the research is aligned with the competencies, there may be questions on the CNE exam that aligns with the concepts that you're going to see in this journal. Okay, so you don't need to go out and purchase this journal if you don't have access. You don't need to spend time reviewing every single journal as you get ready for the CNE exam. That's the heavy lifting that we do in our programs. Okay, so this is why we are taking a little bit of a different turn in the resource we're using. However, it still maps back to Billings and Halstead, teaching and nursing, and the actual blueprint. All right, so I just want to clarify that in case you're wondering, why are we talking about this journal? All right, so this is one important concept that's mentioned in the study. It is a pilot study specifically to develop and assess clinical judgment competencies. Okay, so that was the design of the actual study that we're talking about. The interventions that were used included pre-class assignment, brief clinical judgment review on diabetes, as well as the disease process that is associated with care that's needed for the diabetic patient. A pre-test, there were 2 case studies associated with type 1 and type 2 diabetes, and there was a post-test. So that's a little bit about the interventions and what the pilot study was actually all about. All right, so I just want you to sit with that information just for a second. I want you to write down, if you haven't already, what your objectives are. Now that you know, first of all, what the topic is that we're talking about, which is how can we align problem-based, case-based learning and clinical judgment to help our students learn more effectively. What should those interventions look like? How effective are those interventions? And most importantly, what are your next steps going to be to help advance and elevate the learning that you're requiring of your students? Okay, I'm going to say that again. What are the next steps that you're going to integrate into your teaching strategies to elevate the requirement for learning that you are developing and partnering with your students to ensure they're developing and advancing their clinical judgment skills? That's what this time together in this snapshot is all about. So thinking about these interventions, I want you to also consider, is there more opportunity for you to integrate problem-based learning and case-based learning into the teaching strategies that you're using? And remember, they don't always have to come from us, right? We can leverage the students' clinical experiences that they are actually having if they're in the clinical setting. All right, now we're ready for the thought-provoking question. I just wanted to level set a little bit in case you all were confused. Why are we talking about nursing education perspectives? I thought we were talking about case-based learning, problem-based learning, and Billings and Halstead being the major textbook. Okay, so this is why we wanted to kind of level set and make sure that everybody was with us and we didn't lose anybody. All right, so now we're ready for our thought-provoking question. Let's see what you think about this one. The nurse educator is redesigning a medical surgical course to strengthen clinical judgment using case-based learning. Students demonstrate strong content recall but struggle to transfer knowledge across patient situations. The educator aims to use repetition intentionally to promote deep learning, learner development, and clinical reasoning over time. Which strategy best aligns with effective facilitation of learning and learner development while using repetition in case-based learning? I know that was a lot, so I'm going to give you all a second to really read through what the question is asking you. When you get to the CNE exam, 2 thoughts you want to consider. First of all is exactly that. What is this question asking me again? There's a lot of words, a lot of information in this STEM. So ask yourself, what is the question here? And then second of all, what is it that you know for sure about concepts included in this question? What do you know about case-based learning? How does it align with integration of clinical judgment, application of clinical judgment? Okay, and now we want to take a look at the 3 choices. A, provide repeated faculty-led reviews of heart failure concepts before each case study, reinforcing key content and guiding students through expected clinical decisions in a structured format. B, assign multiple case studies on heart failure with similar formats and expectations, allowing students to independently apply previously learned concepts while maintaining consistent evaluation criteria. Or C, design scaffolded, unfolding case study experiences that revisit heart failure across varied contexts, prompting reflection, peer discussion, and progressive clinical decision making. If you want to take some time to really process this question, you can definitely pause this video and come back, okay? But we're going to keep going in the interest of time in case the rest of the colleagues are ready to move forward with the content, and then we'll close out our time by taking a look at the actual correct answer. And of course, we're going to talk about why. What else is it that we know from this research and the publication that's in, again, Nursing Education Perspectives, the March-April edition? We also know from the discussion section that statistically insignificant improvement in overall category of the Lassiter clinical judgment tool was discovered. Okay, so I want to read it for you all so you have the full context. It says statistically insignificant improvement was demonstrated in the overall category of LCJR, and this is unsurprising. Historically, higher order thinking skills develop over a much longer time frame where learners practice and reflect on a variety of experiences. And how many of you are not surprised by that? Many of us are not, right? We know that in essence what that's saying is students don't get it the first time, right? They have to engage in that clinical practice several times. The first time we insert an IV is going to look very different than the 10th, than the 20th, than the 30th, okay? The first time we inserted a Foley was very different experience for the patient and for us, the first time versus the 10th time versus the 20th time, right? That's all that that statement is saying, and it's no surprise to us. The other point I want to mention from this research is that the subcategory of responding, which relates to the implementation of interventions, did demonstrate significant improvement. Okay, so I thought that was impactful. And there's more narrative. You can read the article for yourself, but there's more narrative as to the contributing factor to that finding. And then we're talking about implications. Okay, so this is the part I want you to pay close attention to. There was a benefit implied of scaffolding case-based learning interventions across the curriculum. In fact, it says that an implication of this study is a benefit of scaffolding interventions such as case-based learning throughout the curriculum so that clinical judgment can develop over months instead of hours, because the intervention that's described in this article was 3 hours. Okay, and we know when it comes to learning, David Cope talks about the importance of having that hands-on experience in order for learning to happen, as well as students going through all 4 phases, with reflective practice being a part of the learning journey, just like clinical judgment, the NCSBN clinical judgment talks about. Also, you have David Cope talking about it, as well as Tanner's clinical judgment model, right? So there's so much impact on the learning process and the development of clinical judgment when our students have a chance to reflect. They think about what went well, what didn't go so well. They get feedback from us. They make adjustments the next time they actually engage in that practice. All right, and then last but not least, I just want us to take a look at this really nice model. I think it's very impactful, and it kind of brings all the pieces together that we're talking about. This is a model that was adapted from the National Teaching League Institute of Applied Behavioral Science Learning Pyramid. And you can see here that it says that 90% of retention it happens whenever we are teaching others, right? So you can see that the span is from active learning to passive learning. We have kinesthetic, visual, and auditory, right? So it goes in a descending pattern, right? Usually we go from the lowest level of learning to the highest form of learning, but I actually like this diagram, this pyramid, in a way that it really calls out the level of learning and the level of retention that happens. Because look at what happens as we move more towards only lecture. 5% of retention is what happens. We know it's very passive, and it does engage with the auditory learner. However, that full engagement, that full learning that happens is most effectively utilized whenever we are engaging with teaching others, when our students have a chance to actually engage in teaching others, right? So this is what we want to do. We'll want to engage in peer learning, group activities, so our students have the opportunity to learn from each other. And what a great way for them to do that, by putting together a case-based learning or a problem-based learning experience. All right, so as we wrap up, let's take a look and see how you did related to this thought-provoking question. So if you chose C, you are correct. So give yourself a round of applause. Designing the scaffolding, unfolding case-based experiences is going to best align with effective facilitation of learning and learner development while using that repetition that we know is really important. Deliberate practice theory also talks about the importance of us closing that gap between when students are actually introduced to these concepts and when they have a chance to practice and apply the concepts that they learn about. Option C is the most correct option because it intentionally uses repetition and talks about it. This is going to support both learning, aligning with competency 1, as well as the development of learning, aligning with competency 2. We allow that to happen when we revisit these concepts in different contexts, right? In different situations related to safe patient care decisions. A good example is going to be sterile technique, when students are doing a dressing change, when they are inserting a Foley, when they're doing trach care, right? That's across different contexts, different situations, but it's the exact same procedure, right? We're still validating that students understand sterile technique. Why else is this correct? Because we're promoting active learner-centered engagement rather than passive learning. It supports that socialization associated with competency 2. It also encourages progressive responsibility and confidence, and it aligns with how clinical judgment develops over time. All right, so it's okay if you didn't choose the correct answer. The most important part of the equation is that you learned something new. Maybe you identified a gap, and now you have a resource to close it. In the CNE 60 Days journey, we know that colleagues often get stuck. We're here to support you not getting stuck, right? So our goal is to make sure that you move forward on your journey in a structured, supportive way so that you can achieve success when you sit down for the CNE exam. We hope that this snapshot has been helpful. Reach out to us if you have questions. We look forward to seeing you in our program. Have a great one, everybody. Take care.